Hello, my name is Tiffany Wall. I'm going to be your student nurse today. Could I get your name and date of birth? Okay, thank you, Mrs. Smith. Do you have any allergies to medications, thing like that? No? Okay, well, I verified your doctor's order, and she has ordered for an IV medication, so I'm going to go ahead and set that up and set up the tubing that goes along with that for you. I've provided for privacy by closing the door, and I'm making sure that the patient is safe. The bed is down, the bed rail is up, and I'm going to go ahead and I'm going to perform hand hygiene. So now that I'm going to be preparing or getting the medication ready here at the bedside, I would have already done 2 medication checks in the medication room. The first one when I went to reach for the medication, the second as I prepared it, and now the third time here in the room, in the patient's room. And I would check to make sure, I would go over the 6 rights. I would make sure I have the right patient, the right medication, the right dose, the right route, the right time. And then I would do my 4th check when I'm finished, when I'm documenting, and that would make 4 checks and 6 rights. So first I'm going to check the IV site in the hand. I'm going to check, and I'd be checking for any signs of leaking fluid, blood, things like that. So I would be looking for infiltration, which is when a medication leaks from the vein into the surrounding tissue. That usually, if it's a non-vesicant or non-irritating medication, then that usually will remain as an infiltration, meaning that it won't progress to extravasation like an irritating medication would. So with infiltration, you're looking for pallor, coolness, some edema. With extravasation, like I said, that usually involves a vesicant or an irritating medication. It will leak into the tissue around the vein like infiltration, but it can cause tissue damage. So for that, I would be looking for maybe redness, pain, some swelling, blistering, and if it got bad enough, it may even progress to necrotic tissue. I would also look for phlebitis, which is an inflammation of the vein itself. So I would maybe look on the hand there and look along the length of the vein to see if it's protruding a little bit more. There may be redness, warmth, some pain, but this site looks good. So I'm going to go ahead and I'm going to look at my supplies. I'm making sure everything's intact. Of course, I've been practicing, so things have been opened. But I would look to make sure things are intact. I would make sure the IV solution is not expired. So I'm going to go ahead. I'm going to open my primary tubing. Primary tubing is good for 24 hours, so I would want to label this with the date and time so that other shifts coming on know when this primary tubing needs changed. I'm going to close the roller clip, and I'm going to go ahead and I'm going to get my IV medication out as well. And this portion, when you spike the IV medication, it needs to be sterile. So I take that off, the spike, and I take the plug out of that area. And if you can see, I'm going to steady my hands. And so I put that in and I twist it to that little notch on the drip chamber there. So my roller clip is on. I'm going to go ahead and I'm going to hang up my tubing here, or hang up my IV bag, and I'm going to prime the tubing. But first I'm going to, let me untangle myself here. I'm going to depress the drip chamber here and fill it about halfway. Okay, and then I am going to slowly open the roller clip or roll it down and prime the tubing. I want to be watching my fluids here. I want to make sure there's no air in my tubing. So I'm going to watch I'm going to try to do this slowly and have this fluid move through this primary tubing and push out any air that may be in there. We don't want air in the tubing. Okay, so if there would be, so I have my tube primed, I have a bowl down here catching the fluid. So I'm going to close my roller clip, but if there would be air in this line, I could, you know, maybe flick it and work the air out of the line. So now what I'm going to do is I'm going to set my drip, and this is, we'll say 20 drips per minute. So I could, for 15 seconds, watch for 5 drops to fall, and that would give me 20 drips per minute. So let me kind of set this. I would have my watch, and I would watch for 5 drips in 15 seconds. I think I need to speed it up a little bit more. Okay, so I have it set, 5 drips, 15 seconds. So I'm going to go ahead and I'm going to close the drip clamp. I'm going to close that drip clamp. The roller clamp is on because it's set for my 20 drips per minute, but the drip clamp is on. So now I'm going to flush the extension tubing to check for patency, to make sure that that catheter is not blocked. So I'm going to go ahead and I'm going to get my syringe ready. And if there's any air in this syringe, I kind of want to invert it so that the air bubble is, I don't know if you can see that, at the plunger. So I'm going to get that ready. I'm going to go ahead and perform hand hygiene again. And I'm going to put my gloves on. I would also have the bag time taped, but we didn't learn that yet. So I'm not time taping my bag right now because I don't know how to do that, but we would time tape the bag. So I'm going to go ahead, I'm going to get my alcohol wipe. And I have my syringe. And I'm going to go ahead and I'm going to clean this port here for 15 seconds. Real thorough. And then I let it dry for 15 seconds. And then I would put that over here. And then I'll make sure, I'm just gonna move this here a little bit so you can see a little bit better. But I'm gonna stabilize, and I'm gonna get that in there and twist. And then I'm going to flush this normal saline for about 2 to 3 milliliters. The rubric says a milliliter per minute. So we'll flush. Okay. And then I'll remove this. And I'm going to have to clean this portion again because I can't reach my tubing here. So I'm going to have to come down here. Because I'm running out of supplies, I know I would need a new alcohol to clean this, but for the sake of the demonstration, we'll say this is a new alcohol wipe. So I would clean this again for 15 seconds since I kind of turned my back on it there. Open this. This over here, and now I'll attach the primary tubing to the extension tubing there and just twist that there. All right, leave that there. And I'm not going to do this, but I would open up my drip clip so that the medication would start flowing. So I would then make sure my patient's okay. I would assess the site, making sure that I'm not, you know, seeing any signs of infiltration, and I'm not. So I would have the rail up, patient back down, have call button nearby. I would clean up all my supplies, and then I would take off my gloves, and I would perform hand hygiene, and that would be my IV and tubing setup. Thank you.